Welcome to our brave new world of virtual programs and the introductory talk of a 12-part series on optimal health and wellness. There's a great deal of information that I want to share with you. I'd also like to make it very clear that while medicine, science, and human knowledge are more advanced than they have ever been, we are still more ignorant than knowledgeable. We are on an exciting and ever-accelerating course of acquiring further knowledge and deeper understanding. Much of what we have believed in the past to be factually correct was later discovered to be in error. Much of what we believe today will likewise be discovered to have been beliefs mistaken for truths and will require revision or replacement with new knowledge. This reminds me of my very first day of medical school many years ago. The dean, on welcoming the entering class, quoted a former dean at Harvard who promised that the faculty will strive to teach everything they know about medicine over the next 4 years. Yet he warned there were two problems, one minor and the other major, that must always be kept in mind. The minor problem was that half of what will be taught will be proven wrong over the years to come. The major problem was that they did not know which half was wrong. Another valuable quote to keep in mind as you look at health information and keep it in perspective is from Mark Twain. He said, "Be careful following the advice you read in health books. You could die from a misprint." Next slide. This is a cartoon image. We wanted the Army guy, not the gastroenterologist. This is from Dan Ferraro, a good friend of mine who creates the Bizarro cartoon strip, which is nationally syndicated. I have had an intense curiosity from a young age, and with broad and diverse interests, I pursued a very eclectic educational pathway. Tragically, my mother was dying of metastatic breast cancer at a young age, and I was in a rush to go to university, complete the curriculum, and go on to medical school. My goal being to discover and develop a cure for cancer to save her life. I attended 3 different universities beginning at age 16, each university unaware that I was accepted and attending the others as well. While I had a great interest in many subjects, to avoid discovery of my accelerated curriculum at more than one university, I had 3 different majors: Invertebrate Zoology, Astrophysics, and medieval English literature. Although my education was through the traditional academic American university and medical school system, I have always maintained a healthy skepticism about what is accepted as knowledge, and a keen interest in medical history, alternative and integrative medicine. My personal philosophy is that no single approach has a monopoly on wisdom, nor have there been uniformly successful efforts in keeping false beliefs and dogma from hindering the advance of the state-of-the-art of medicine and science. To my medical colleagues, I am a clinical professor of medicine at the University of California, San Diego. As a specialist in internal medicine and as a subspecialist in gastroenterology and hepatology, I recognize that these terms are too long and complex to use routinely. I have been given the adopted nickname of G.I. Joe, and there is the cartoon tie-in from Dan Ferraro. It's G.I. Joe. They wanted the Army guy, not me, the gastroenterologist. Next slide. But there is a tie-in to G.I. Joe. It's a double entendre, and it has a double meaning for me, as I also have a background in international and tropical medicine, including a jungle survival program with the U.S. Army Rangers, known as the Green Berets, and the U.S. Navy Tropical Medicine Program. I have been a close observer and active participant in the practice of clinical medicine for many decades. From extensive experience as a student, professor, practitioner, administrator, researcher, expert witness, and adjudicator, I believe that I can offer valuable and balanced insight into the medical profession and the healthcare system. While modern medicine has its share of spectacular successes, it also has significant defects and chronic failures. The vast majority of healthcare consumers have never been offered the basic guidance and knowledge required to minimize risk and maximize benefits. As a medical professional who is also a professor, professional speaker, author, and passionate educator and communicator, it is my intent and hope that this series of talks will provide this important knowledge in an informative and engaging manner. Next slide, please. Most people fail to appreciate the very important distinction between a belief and the truth. When a belief has been confirmed as the truth, we refer to it as knowledge. There is a distinction between the two, and there is not always a clear dividing line. The line can move as more information is gathered and considered, creating a spectrum from belief to knowledge. Next slide, please. Wisdom is different than knowledge, as Albert Einstein makes very clear in this analogy. Knowledge is realizing that the street is one way. Wisdom is looking in both directions anyway. While both have value, wisdom is potentially much more powerful and life-altering than knowledge. Next. Albert Einstein was one of my heroes, and his brilliance and sophistication was balanced by an immense sense of compassion, humanitarianism, humility, and humor. I hope that you will join me and others on this extended series of talks and tolerate my habits and eccentricities of adding what I hope is always on-point humor, philosophy, trivia, and enhancing imagery. Next slide. Life expectancy. What is it? There is also growing evidence that chronological age is not the rigid barrier to enhanced longevity that we once thought. Life expectancy has expanded over the years, but more than just life expectancy, we want to have enhanced vitality, not just chronologically more time. The present day average figure of 2 decades of extended life for a 65-year-old may very well be a significant underestimate of life expectancy in the near future. We have, and may well have, many more decades ahead of us, even at age 65. Next slide. Yogi Berra, the baseball player, was known for his quips, such as, "It's deja vu all over again," or, "Half the lies they tell about me aren't true." And one of my favorites, "Baseball is 90% mental and the other half is physical." Another baseball legend, Mickey Mantle, had another memorable quote, "If I knew I was going to live this long, I'd have taken better care of myself." Next slide. Wellness is much more than physical health, and yet physical health is required to fully optimize all of the other aspects of wellness, which will be the focus of this 12-part program. We will address the divergent approaches to evaluating, protecting, and treating physical health concerns, from basic general principles to practical specific examples. This extended program will address infrequently discussed but very important topics. Don't let the following shopping list of topics in. We will have plenty of time to cover each one comfortably to allow your full understanding and appreciation. Topics will include communication, prevention, diagnosis, therapy, quality assurance, knowledge limitations and advances, experience, economics, research, the list continues, marketing and promotion, competition, insurance, defensive medicine, overutilization, malpractice, advocacy, pseudoscience and fads. Okay, I think I'm covering too much ground, but we will have time for all of this and more. There is a lot of information I'd like to share with you. And again, it will be done, hopefully, comfortably. If it's not comfortable, you always have the control, since these are virtual programs, to slow down, rewind, or stop the programs at any time. You are in control. While these programs will expose unpleasant truths, the intent is not to frighten you, but to raise awareness and enhance prevention. Ignorance is not only not bliss, it can be life and health threatening. Being aware allows proactive prevention to safeguard your hard-earned health and wealth. I suspect that you will find that simple common sense is the most important skill set that you need to navigate the healthcare system and protect your optimal health and wellness. This is a funny cartoon, but not everyone may appreciate it. When different words sound alike, they are referred to as a homophone. This is a humorous example of a near homophone, as one deer is saying to the other, "Look out, ice hole." And the other deer is saying, "What did you call me?" Next slide. The New Yorker magazine, while infamous for its sophisticated cartoons and humor, is not beyond straying into social satire and scatology. As we are in the midst of the COVID-19 coronavirus pandemic, with the ubiquitous face mask now becoming standard, this term for someone who does not honor the protecting of others is, from the New Yorker, mask hole. The consequences of miscommunication leading to medical errors is a staggering 10,000 complications a day, up to 400,000 deaths per year, and $1 trillion in cost. 80% of serious medical errors involve miscommunication between caregivers at transition of care, such as at shift changes. This brings a new double entendre meaning to the phrase, shift happens. While most may know this, for those that do not, this is one of my moments of sharing trivial knowledge about our language. A double entendre is a figure of speech or a particular way of wording that is devised to have a double meaning, one of which is typically obvious, whereas the other often conveys a message that would be too socially awkward, sexually suggestive, or offensive to state directly. Next slide, please. The single biggest problem in communication is the illusion that has taken place. This is a quote from George Bernard Shaw, the brilliant Irish playwright, critic, polemicist, and political activist. He was awarded the Nobel Prize in Literature in 1925 and lived for another 25 years in well-deserved celebrity and notoriety. Next slide, please. While the healthcare provider should take the initiative in making sure you understand, they all too often fail to do so. It is extremely important that you repeat for the provider what you understood and receive confirmation that your understanding is correct. Next slide, please. One of the more important decisions to be made as a healthcare consumer is selecting your healthcare provider. Depending on your healthcare insurance plan or network, you may be randomly assigned your provider from the insurance company panel, or you may have the ability and flexibility to select your caregiver. The differences in healthcare providers are vast, with wide variations in education, philosophy, personality, accessibility, empathy, and other professional and human qualities. Just as there is a degree of luck as well as skill in identifying potential high-quality personal friends and professional services, There are no assurances or guarantees. Continued reevaluation of the relationship and quality of services is necessary. There are general points of guidance provided during these programs that I will be offering that will help the consumer, but there is much more that can be shared to raise the likelihood of an excellent match. Next slide, please. Should you trust your doctor? Trust should be earned, but there are circumstances, especially when an extremist, where trust must be taken for granted. The good news is that the vast majority of healthcare providers and people in general are well-meaning. Unfortunately, there are also others who have a flexible moral compass, and their personal and financial gain can influence the care and services they offer. One must remain vigilant. And if there is any doubt, a second or third opinion should be sought. The situations where it is reasonable and appropriate to question whether your trust is reasonable or misplaced are when there is a potential conflict of interest. The most common situation is where the provider has a financial interest in your care above and beyond the routine professional fees for a standard office visit. Frequent follow-up visits, procedures, surgery, interventions by the provider or associates, utilization of an outpatient imaging physical therapy center or surgery center, chemotherapy, radiation therapy, durable medical devices, hospitalizations, convalescent rehabilitation hospital fees, etc., are more frequently overutilized when the provider has a financial interest in the facility used. Having a financial interest is not uncommon and is not by itself a problem, as long as it is disclosed and it is not being overutilized. Next slide. On this slide, a number of the factors that consumers use to rate physicians and other healthcare providers are identified. It's fascinating to me that amongst the indicators that people use, having a high quality provider provide an accurate diagnosis and having competence are not the leading indicators people select. Having an attentive listener is considered more important than knowledge, accuracy, and competence. That is not to minimize the importance of an attentive listener, but knowledge, accuracy, and competence really should be towards the top of the list. Next slide. Dan Reynolds, another friend, is an award-winning, nationally syndicated cartoonist. He's also a collaborator with my spouse and I, as we've written many books, including a number of humorous books, which include fascinating trivia and full-color award-winning cartoons from Dan. When we shared with him our philosophy and commitment to compassionate care, I may have waxed too poetic. I shared with him one of my favorite self-deprecating lines of humor that I like to use. It says that I used to think so highly of myself that I was thought to be conceited. But now that I have corrected that fault, I am no longer conceited. Now I am perfect. Dan's humor of the GI doctor with the greatest degree of self-recognized empathy is perhaps over-revealed if you look in the mirror behind the standing physician. Next slide, please. The volume of research published has grown exponentially, as has the number of research scientists, physicians, corporations, and institutions. The sponsorship of research and publications by industry, government, lobbying groups, societies, and special interests has made it very difficult to identify hidden biases and agendas. Much of the research published have flaws and limitations that are not readily apparent or disclosed. Fraud in biomedical research, while fortunately not common, still occurs with regularity because of financial, professional, or personal interest. the penalty for research and publication fraud is minor compared to the harm it causes. The sheer volume of publications makes it impossible for anyone, including computerized databases, to stay current, as they require the published research to be reviewed, analyzed, and assimilated into current understanding and guidelines for optimal care. Next slide. This sophisticated cartoon makes a pointed reference to the fact that the original quote, that there are lies, damn lies, and statistics, is often attributed to Mark Twain. Actually, it is properly attributed to British statesman and former Prime Minister Benjamin Disraeli, who served during the reign of Queen Victoria. It's an introduction to the tie-in of statistics and research. And as Benjamin Disraeli and repeated by Mark Twain confirmed, statistics can be not only a valid science, but also an opportunity to mislead and misrepresent. Next slide, please. Statistics are used routinely in medicine and the life sciences. The concept of average, median, standard deviation, and how normal is defined in the life sciences is really underappreciated. A median, which many people think of as an average, and it is different than the average, is the value that separates the upper half from the lower half. This may be the same as the average, and many people use the terms intertwined, but an average is the sum total of all the data points divided by the number of data points. It doesn't always have to be that they are the same. When normal is defined in the life sciences, it is defined as the range that would include 95% of all samples, using a statistical analysis method that defines the average plus or minus 2 standard deviations. You don't have to worry about the details and the terminology. The point I wanted to make is that this bell curve on the diagram shows what is considered average within the clear section of the graph, while the slash section, the 2.5% above and below, together comprises 5% of the population. That is, 2.5% are considered above average, 2.5% below average. Statistically, the middle 95% is considered within the range of normal. Now, this is a statistical definition of normal and is used routinely in medicine. So when you have a blood test and you are told that you are normal, or you are told that you are low or high, if you are in the 95% main group, you are called normal. If you're in the 2.5% elevated, you are called high. 2.5% lower, you are called low. But not everyone is at the same level of average. The average ranges over a wide area of the graph. So when you use a population as the basis for normal, you're relying on an average, but a very wide average. And it is only the very rare individual that is actually in the middle of the average range. Everyone is typically higher or lower than average. And each person really should be the definition of what is normal for themselves when they are in perfect health. So when you have a laboratory test, by statistical definition, 5% of the population must be out of the normal range. So don't get overly concerned if you have a test that says you are high or low. It may not be all that meaningful. Next slide, please. When it comes to integrating the extraordinary volume of research findings and advances, you have to keep in mind the complexity of each individual. Each individual human is made up of 37 trillion cells. In addition, a human has over 100 trillion microbes that are now considered part of the human organism, known as the human microbiome. In addition, there are astronomical numbers of chemical and metabolic reactions occurring each and every second. All of these interactions with the infinite number of variables cannot be kept track of even using super or quantum computers. It really is an astronomical world within. Next slide. Let's move from astronomy to the lower back, something very common and simple, low back pain. It's very common, yet very painful, disabling, and a very expensive condition. Many suffer from recurrences and have chronic back pain. And this can affect any one of several regions: the thoracic or upper back, the lumbar or mid back, the sacral area or the lower back. While the end result of back pain may be indistinguishable, pain, immobility, suffering, the underlying causes may be widely divergent, with completely different therapeutic approaches and prognosis, the likelihood of recovery. The key to the proper treatment is making an accurate diagnosis, and this may be quite challenging. Next slide. Many common complaints and symptoms, such as low back pain exhibited, can have a myriad of different possible causes, and the proper diagnosis really is required to identify the correct treatment and the prognosis. As the problem is assessed, the various diagnostic possibilities are described as the differential diagnosis. The list of possibilities is narrowed as additional information is obtained from the medical history, physical examination, laboratory studies, imaging tests, the course of the illness, and response to therapy. Next slide. On this slide, I have just a partial list of the variety of different healthcare professionals and providers that may offer services for back pain alone. The consumer may find a practitioner as a referral from their primary healthcare provider, a friend or a neighbor, from searching the telephone book, the internet, or advertisements. If the consumer is not aware of the very different approaches, standards, expenses, and outcomes, they may make a selection based on a very limited amount of information. The concept of caveat emptor, the Latin phrase for let the buyer beware, has become an English proverb commonly used in commerce and contract law. It is all too applicable in healthcare, yet it is also very unfair to most consumers who are not familiar with the wide diversity of services and providers. They are also often in pain and in urgent need of care without the time and knowledge to make an intelligent selection. Content offered later in the series will provide basic practical information on how to make the proper selection or the most informed selection of who to seek care from. In the meantime, having a trusted primary healthcare provider, a knowledgeable family member, friend, or neighbor, or access to a professional patient advocate can be extremely valuable in making sure you are guided to the right provider. Next slide. In this cartoon image, the doctor is saying, I'm going to refer you to some kind of ologist. The suffix ology denotes knowledge of, and the prefix is usually of a Greek or Latin language origin, identifying the anatomical location or treatment approach. Some of the terms have so many syllables or are so complex that abbreviations, acronyms, or the equivalent English language terms are simply used in front of the title doctor to denote a particular specialty. For example, otorhinolaryngology is a specialty focusing on disorders of the ear, nose, and throat. and as specialists are often commonly referred to as an ENT doctor, nose doctor, throat doctor, ear doctor, etc. A gastroenterology specialist is often referred to as a GI doctor. Next slide, please. Medicine has been described as complementary, integrative, traditional, modern, oriental, Ayurveda, osteopathic, chiropractic, homeopathic, functional, or whatever term is in vogue. The bottom line is that it provides healthful benefits, and if it does indeed provide healthful benefits, it should be called medicine. There's not a single correct approach for all people. As unique individuals, we may respond in different fashion to different approaches. What may be beneficial for one may be harmful to another. One should be respectful of alternative viewpoints, and it is not uncommon for an approach considered to be heretical or pseudoscience at one point in time to be rediscovered and recognized as an advance at another time. Acupuncture, which was suspect as pseudoscience in Western medicine, has moved into the accepted armamentarium. Even science-supported pharmaceutical therapy has all too often found to be flawed, harmful, and subsequently withdrawn from the marketplace. It is prudent to question the credibility and evidence supporting any therapeutic endeavor. While some therapies can simply be stopped or reversed if the therapy is not effective, and all you lost is some of your hard-earned funding, some adverse consequences, such as complications from surgery, are often irreversible. Next slide. A primary care physician usually refers to an allopathic, that is the MD, or osteopathic, DO, trained doctor, who serves both as a direct provider of basic professional healthcare services, as well as an access point to specialists and subspecialists for more complex or in-depth healthcare services when they are required or desired. Many providers participate in an insurance, hospital, or regional referral network, which has its own quality assurance process to validate that the education, training, and certification of their providers meets their standards. Family medicine and general practice are the primary care providers with the greatest breadth and depth of clinical experience and training. The longer the physician has been in practice, it is often assumed that the greater their clinical experience. Although on the surface it appears that a physician in practice for 20 years should have 4 times the experience of one in clinical practice for 5 years, this is not always the case. If the 20 years of practice were for 2 days a week, and the 5 years of practice were 24 hours a day, 7-day a week call coverage for only 5 years, that person would have twice as much clinical experience as the one with 4 times as many years of clinical service. Likewise, although the breadth of experience is wide, the depth and clinical expertise for specific conditions is frequently more limited than that of specialists, even those just recently in practice. One also should keep in mind that maintaining the knowledge base of current medical care is incumbent on every provider, and state licensure often requires a minimum level of participation in approved continuing medical education programs. The reality is that it is impossible to keep current on all of the advances, as on average, over 8,000 biomedical research papers are published in journals every day of the year. This number is accelerating, and even services designed to summarize advances in care are often months behind, and even these reports are too voluminous for providers to process. Specialists have the advantage of limiting the breadth of their field of expertise to advance their depth, but this also has a disadvantage of restricting their diagnostic considerations and approach. The saying goes that someone equipped with only a hammer tends to look at more problems as if it were a nail to be hit. While family practice covers everyone, Pediatrics is the primary care field of choice to take care of children. Obstetrics and gynecology is often considered the primary care field of choice for women. Internal medicine is considered the primary care field of choice for adults, and yet geriatric medicine, also known as gerontology, is growing in popularity as the primary care field of choice for seniors. Much like pediatrics for children, there is an attractive logic to focus on the care of a specific age group. Illnesses may have unique presentations, and therapeutic approaches should be tailored to the needs and circumstances of each individual. All things being considered, a senior would be best served by having a gerontologist as their primary care physician. The problem may be in locating an available provider. Next slide. Humor in cartoons can be enjoyable, thought-provoking, and biting all the same. In this cartoon image from the New Yorker of a way too general practitioner who's looking in the patient's ear and saying, "Could be anything." Well, the general practitioner and family physician are all too often considered to be less prestigious and accomplished fields. As a subspecialist, I would respectfully disagree with this assessment. I am in respect of their ability to handle so many varied and challenging conditions very well. If I were traveling remotely away from other medical services, in the event of an emergency, I would much rather be in the company of a general practitioner than a highly regarded cosmetic proctologist. Making fun of other doctors and their specialties is a professional pastime for many in healthcare. One story is about how to tell an internal medicine specialist from a surgeon when a hospital elevator door is closing prematurely. The internal medicine specialist will put their hand out to stop the doors from closing. But for a surgeon, their hands are much too valuable to put them in jeopardy. Instead, they will put their head in the doorway, since they don't use that as much, and it is not as important as their hands. Next slide, please. Besides having concerns about the quality and knowledge base of the provider, there is another health literacy concern that affects healthcare quality, and that is the knowledge base of the consumer and patient. No one would expect the average consumer to have broad and in-depth knowledge about illness, but it is a reasonable expectation that they would have a basic understanding of health and well-being, including nutrition and diet, physical fitness, stress management, sleep, and preventive care. Further education and knowledge to achieve optimal well-being and understanding of any conditions they may have or be prone to would also be desirable. Unfortunately, as a society, our educational and social system has failed to provide this degree of healthcare literacy. 88% of the American public has health literacy skills below the level of proficient. Next slide, please. Communication is key, and as is discussed in later segments of these programs, we'll talk about how language is just one limited aspect of communication. The consumer patient and/or their advocate must clearly express and communicate to the healthcare provider an accurate presentation of the full story of their medical history, the course of care and their response, and their goals and desires. There is no right or wrong. There should be no embarrassment or judgment, just open, honest communication based on trust and the compassion to help care for one in need. If the consumer and their advocate have presented a thorough review bringing the provider up to the present time, one still must make certain that the provider was listening and understood what was said. A reasonable and practical way to do this is to ask the provider to summarize your history for you, because you want to make sure that what you said was what you meant to say, and that it was accurate, and that you did not miss anything important. By phrasing the request in this way, it places the possibility of misinterpretation or misinformation on you, rather than implying a fault in the listening skill of the provider. Of course, that is exactly what you want to find out if they were listening and listening carefully. But you have to be careful not to offend your caregiver. And you can accomplish this task with adept interpersonal skills. If you find that your doctor was not listening, and there are some who do not listen, I would strongly encourage you to find another healthcare provider, one who does listen to your history and concerns. Next slide. Assuming that you are comfortable that your provider has listened and understood your concern, the 5 questions on this slide are important and should be asked without fail before any diagnostic procedure or testing, before embarking on a course of therapy, and especially before undergoing any surgeries or invasive procedures. It is very reasonable to ask about your provider's experience. And as with any major decision, getting a second opinion is prudent. I would discourage asking your care provider for who they would suggest for securing a second opinion. The person they recommend may well be a colleague, friend, or an associate who is much less likely to offer you an alternative or different opinion. Nurses are often very credible resources to identify an excellent provider for a second opinion. A last question to consider is asking your provider this: is there anything that I have forgotten to ask you about that you think is important to know or consider? Next slide. Being truthful can bring refreshing and valuable insights and solutions to many long-festering and stress-inducing problems. In this cartoon, the patient is saying, "Give it to me straight, doc. How long do I have to ignore your advice?" Rather than coming back months later saying the advice you gave me didn't work and you never even tried it, it's better to be straightforward and honest and say, I'm not going to be able to comply with that. Or do you have an alternative suggestion that I can try? Because that doesn't resonate. That's not something I'm going to be able to do. Much better use of your and your provider's time and information. Next slide. Time is a limited commodity that is at the essence of high-quality healthcare services. Most healthcare today is based on a 30 to 60-minute first-time consultation or introductory new patient visit. This is the basis for all future interactions, which are commonly 15 to 20-minute follow-up visits. The reality is that government and insurance company dictated information acquisition that must be entered into the electronic medical record takes a minimum of 10 minutes and often more. Following the initial patient description of the current problem is additional history gathered in question and answer form, physical examination, review of laboratory and imaging results, discussion and planning, dictating and entering the information into the clinical record. Well, if you have been paying attention, you might recognize that the office visit ran out of time over 15 minutes ago. In later programs, I will review what is involved in the oftentimes maximum 60 minutes offered for a comprehensive medical evaluation and consultation, and the 20-minute follow-up care, and highlight the consequences of the time restrictions and a potential restriction. Next slide, please. The fact that the typical patient-doctor interaction often occurs in only 18 seconds of uninterrupted time says it all. 18 seconds before the doc or healthcare provider typically interrupts the patient. This is a healthcare system that has failed patients, providers, and society. We are often offered more personalized care when we bring our car in for service or a pet to the veterinarian. No one likes the present system, and both providers and consumers should work to enhance the communication in the time we are given. Next slide, please. These are just a few of the areas of a complete medical history and physical examination, which has been the basic tool of medical diagnosis for over 100 years. We will review these in detail in later programs. as well as going over what is involved in each of these and other aspects of the history and physical examination. It will become readily apparent that the initial visit, which collects the basic information that all subsequent visits are dependent on, cannot possibly be accomplished in 30, 45, or even 60 minutes. 90 to 120 minutes should be the minimum allotted time, and often, especially in complicated, complex, or in the history of those with long lives or multiple illnesses, even more time is required. In later programs, I will attempt to demonstrate with examples the importance of each aspect of the history: physical examination, laboratory, imaging, and other aspects of the consultation. Next slide. The term diagnosis has been popularized as medicine has been portrayed in the news media, literature, television, and film. In spite of even the most challenging cases being solved and effectively treated within 60 minutes on television, the reality is often very different than the fictionalized version. The process of starting with a wide range of possible diagnoses, known as the differential diagnosis, which is narrowed down to the collection and evaluation of history, physical examination, laboratory, imaging, and other studies, is time-consuming. The working diagnosis is the presumed diagnosis, while the definitive evaluation continues. While most cases have a single underlying cause of illness, multiple diagnoses are possible and can complicate the evaluation and treatment. The course of the illness and its response to treatment require that the diagnosis be reconsidered if it is not responding as expected. There are quite a few times when different providers will disagree about the diagnosis, and this can quite appropriately be a source of great concern, as the correct diagnosis is often the key to the correct therapy. A second or even third opinion can be of value, yet at the same time add another level of confusion, stress, and expense. As healthcare providers tend to have generous egos, it may take a diplomatic primary care provider, an assertive patient, or a patient advocate to determine which course of action to follow. Unfortunately, the brilliant medical detectives on television or other media outlets are rarely available for consultation. Next slide, please. There are many famous detectives in the history of literature and entertainment. The creator and author of the Sherlock Holmes stories, Sir Arthur Conan Doyle, was himself a physician and medical detective. The nature of being a clinical diagnostician is being a detective in the truest sense. I have been very fortunate in having mentors in clinical diagnosis who were passionate and skilled interviewers and examiners, and who were exemplary medical detectives. For many years, I have been sharing the skill and knowledge with medical students, nurses, other healthcare providers, and patients. I have always found that encouraging the patient and those close to them to participate in the detective work of the diagnostic evaluation has added a positive engagement and the often offering of additional valuable, useful information that would have not been discovered otherwise. Next slide. While the comprehensive medical history is a very valuable document, once one enters a routine American healthcare system, a healthcare provider in a 15-minute visit will not even be able to glance through it. A concise summation of current medical diagnoses, treatment, and status, a clear listing of current medications and over-the-counter OTC products, dosages and indications, and a clear identification of allergies, sensitivities, and past medical history should be summarized on a single typewritten page, along with name, telephone number, emergency contact information, name and telephone numbers of healthcare providers, and pharmacy. This single-page medical summary can be extremely valuable during healthcare provider visits, while traveling, and in emergencies. Next slide. Medical records are in error a significant percentage of the time. Misfiling, mislabeled reports and results, misinformation can lead to serious and even life-threatening errors. Securing a copy of your medical records from previous hospitalizations, surgery, doctor offices, surgery centers, laboratories, imaging centers, etc., is labor-intensive, but it is doable. A healthcare professional acting as your medical historian can review these records for information to be included in a comprehensive medical record summation. Having reviewed tens of thousands of medical records, my experience confirms what we already know, that errors are common, ranging from the trivial to the potentially life-threatening. The simple mistaken addition of the word "not" to the statement, "the patient is allergic to penicillin," can make a life-threatening difference in the care of a patient. It could also be a typographical error that can result in a life-threatening complication. Next slide. 5%, or 1 in 20 Americans, are misdiagnosed each year. This results in mistaken and ineffective treatment with potential adverse events, a delay in the proper care and therapy, and extra and unnecessary expenses. Fortunately, only half of the 12 million misdiagnoses each year in the United States are harmful. Unfortunately, that still leaves 6 million avoidable yet harmful adverse events each year from misdiagnosis alone. Up to 20% of all cancer patients are misdiagnosed. Delayed or incorrect diagnosis can have devastating consequences in cancer care, as cancer therapy itself is challenging, has significant risk, and ineffective treatment can have a fatal outcome. Next slide. What could possibly go wrong? On this slide, I have listed provider errors as well as systemic errors that are commonplace in the American healthcare system, and it's not just unique to the United States. There are also possible errors that can occur because of patient error or caregiver errors, the incorrect dose or the incorrect application of therapy, forgotten medications, forgotten conditions or allergies. With so many opportunities for errors, it is not surprising that they occur at such an alarming rate. One must be proactive to guard against and prevent errors and to identify and correct them promptly when they do occur. Even high-quality, experienced, and caring healthcare providers make mistakes. Whenever an important decision about healthcare must be made, such as a decision about surgery or a life-threatening diagnosis, securing a second opinion can substantially reduce the risk of misdiagnosis or inappropriate therapy. The expense of a second opinion is minimal when the potential savings are considered. When a second opinion is sought, it should be from a neutral source, not from the same healthcare provider group or affiliated network. Nurses can be a great source of referral to a quality provider. Even high-quality, experienced, and caring healthcare providers make mistakes. Whenever an important decision about healthcare must be made, such as a decision about surgery or a life-threatening diagnosis, securing a second opinion can substantially reduce the risk of misdiagnosis or inappropriate therapy. The expense of a second opinion is minimal when the potential savings are considered. When a second opinion is sought, it should be from a neutral source, not from the same healthcare provider group or affiliated network. Nurses can be a great source of referral to a quality provider. Next slide. This cartoon says it all. Medical error is nonsense. Your hysterectomy was a complete success. And the patient says, I came in for a tonsillectomy. Medical terms, confusing, as I mentioned before, hyster, Greek, has to do with the uterus, so hysterectomy. Tonsils, a different area of the body entirely. Well, maybe you don't need that much a detailed explanation for a cartoon. There are so many medical terms that although as physicians we think they're complex and you may not know them, if you've been around television, literature, the American society, hysterectomy, tonsillectomy, appendectomy, you know what? Those are no longer foreign terms. They're well understood, even by children. Next slide, please. The number of deaths attributed to medical errors in U.S. hospitals each year is conservatively estimated at 440,000. That is a staggering number. That is over 1,000 deaths per day, the equivalent of 2 jumbo jets crashing, with the total loss of life of everyone on board every single day. If errors cause 2 jumbo jets to crash with loss of life every day, the whole airline industry and flight control system would be shut down until it were corrected. Yet in the United States healthcare system, the carnage continues unabated. And this figure is for hospitalization only. If you expanded it to include all of US healthcare, including in the outpatient arena, rehabilitation, nursing homes, etc., the number of deaths per year may well exceed 1 million. Next slide, please. Pharmaceuticals are developed, promoted, and consumed in prodigious quantities and at great expense. Direct-to-consumer advertising, known as DTC, of both prescribed and over-the-counter products has continued to promote overconsumption. Nutraceuticals, herbal products, vitamins, minerals, probiotics, prebiotics, homeopathic remedies, and many other products are unregulated or underregulated. The potential interaction between these products and each other, or prescribed products, raises additional health risks and concerns. Both enhanced or reduced potency are possible results of interactions, each with their own consequences. Next slide, please. The drug approval process is arduous, time-consuming, and extremely expensive. Often, thousands of subjects are included in the research protocols. The data is analyzed, but not all population groups are necessarily represented. Once approved, ongoing post-marketing surveillance for effectiveness and safety is voluntary, sporadic, inefficient, and delayed. This has resulted in FDA drugs being marketed for years or decades, with millions of patients exposed and tens of thousands of adverse events and fatalities before a drug is identified as having a hazard and withdrawn. A unified national post-marketing surveillance program should be implemented to improve drug safety and safeguard the public. Next slide, please. The cartoon says, heads, you get a quadruple bypass, tails, you take a baby aspirin. When offered 2 alternative approaches, be careful about the unstated financial incentives that may be influencing your provider. The compensation from open heart surgery is infinitely more attractive to the provider than advising aspirin. Even if you want to get your money's worth of benefits from your insurance, do not underestimate the risk, discomfort, time, and out-of-pocket expenses from more invasive care. Before submitting to any invasive or expensive therapy, secure a trusted second or third opinion. Next slide, please. This slide statement contains a great and valuable lesson. Your health is an investment, not an expense. And the asterisk says, however, it will become an expense if you do not invest in it. Next slide, please. Long trusted CBS network, excuse me, long-term trusted CBS network news anchor Walter Cronkite is quoted as saying, "America's healthcare system is neither healthy, caring, nor a system." This biting criticism, unfortunately, has a truthful foundation. Next slide. Consumer and patient advocates can enhance quality assurance, safety, and cost effectiveness. Although some insurance companies and healthcare systems offer advocacy services, their focus is not necessarily in alignment with the consumer. An advocate for the insurance company has a primary interest in reducing the consumption of healthcare services, protecting the insurer's bottom line. An advocate for a healthcare system, including its hospitals, clinics, and providers, has a priority to appease the consumer to avoid litigation and a malpractice claim. Their focus will not be the same as a patient consumer advocate who tries to enhance quality assurance, avoid medical errors such as misdiagnosis, prevent the inappropriate overutilization of services, assist the consumer in identifying the preferred clinical care approach, and help them navigate the healthcare system that is more of a maze and a labyrinth than a system. Next slide. On this slide, I've listed some of the content of topics that I'll be covering in greater detail, each one in a separate program. I would welcome suggestions and constructive criticism to improve this program and enhance its value to you. I know we've covered a lot of ground and there is a lot more content to cover. I hope that you find this of interest and benefit, but also as we go to the next slide, just want to let you know, and this cartoon says, "Mr. Osborne, may I be excused? My brain is full." Just in case you feel that there is too much information, you may be excused at any time. That is the beauty of your virtual talks. You do not even have to raise your hand or ask. You can pause, stop, rewind, or leave whenever or wherever you are. This next slide is a summary slide, some general tips for living younger longer. We will cover these in greater detail with a lot more information to come in the upcoming sessions of the programs, which I hope you will join. And I would like to end with words of wisdom from the Dalai Lama on the next slide. The Dalai Lama, when asked what surprised him most about humanity, answered, "Man," because he sacrifices his health in order to make money. Then he sacrifices money to recuperate his health. And then he is so anxious about the future that he does not enjoy the present. The result being that he does not live in the present or the future. He lives as if he is never going to die, and then he dies having never really lived. I do want to thank you for your kind attention. On this next slide, I have listed my website. If you wanted to look at some of the additional books and content that is available, they are available to you. I have a wealth of information. The books contain much more information than I can possibly cover in the brief time we've allotted to the audiovisual programs. In addition to these 5 titles, there are an additional 20-some books, including humor, trivia, the great cartoons of Jan Reynolds, which make wonderful gifts. So there's a lot of information to share. I hope, again, you will join me for the upcoming continued series and enjoy the rest of the Healthy Aging Conference. And thank you for your kind attention. Thank you.